This morning, we're taking a closer look at what affordability really means for families in Central Texas. Dr. Gavrizi, a fertility specialist with Texas Fertility Center, is here to break it down. Great to see you, Dr. Gavrizi.
Thank you so much for having me.
So first off, what is your initial reaction for fertility specialists like yourself from hearing the president talk about the affordability of this drug? You see so many families and work with so many families who probably struggle to pay for it. So what's kind of y'all's
Exactly. It's very, very exciting. So there's a discrepancy between insurance companies and providers. A lot of insurance companies treat fertility treatment as an elective treatment option, whereas infertility is a well-recognized and well-defined diagnosis. And so anything that helps improve access to care is great, and we're very excited about it.
What do you wish more families maybe... I feel like a lot of people won't know what IVF is all about until they're struggling with it themselves and have to learn what it's about. So what's one thing that you wish that families at home realized about IVF?
The main thing is that there's this view that IVF is this like luxury last resort treatment option, but in reality, for a lot of families, it's the only way that they will be able to conceive. And so anything, again, that improves access to this is what we're hoping for.
You're also telling us that AI, new technology, artificial intelligence, is helping to shorten the time to get pregnant for many couples. So how does that work?
That's our hope. So the use of AI is being studied extensively in the IVF lab. The beauty of IVF is it's the only scenario where we're able to look at eggs, look at sperm, and the embryos that are created. A lot of that now is done subjectively with our highly trained embryologists, but the goal is to add AI to this. So our lab Ovation is hoping to use this alongside with our embryologists to find which embryo is the best embryo, improve the time to pregnancy, which will then decrease the cost of the overall process.
So is that kind of the best example of how lab Ovation Fertility is using the data science to improve success rates? Any other examples?
It is. So it can be even looking at sperm, like which sperm is the best sperm to use to fertilize, which embryo is the best embryo to transfer. That's our goal with this.
That's super cool. Okay, why is IVF so expensive? We just saw that we're hoping to bring those prices down, but really, why is it so expensive, even with advances in medicine?
Unfortunately, it's still a complex process, even with all of the advances that we have. So it involves taking medications, it involves a procedure under anesthesia, and then it involves a lot of specialized laboratory work. The problem, again, is that for the vast majority of patients, none of this is covered, and so it really does increase the burden of this.
If someone's watching at home and they're struggling to conceive and kind of, defeated and discouraged, listening to this, hopefully it brings them some hope, but also what's your message to them at home? What do you want them to know?
I think the main thing is that if you're struggling to conceive, the first step is to gather information, and so it would be to see a reproductive endocrinologist like myself, to see your OB, and gather that information and see what the best treatment option is for you once we have that info.
So your Texas Fertility Center,
yes,
what's the best way for someone to come make an appointment with you?
So we have our website, it's txfertility.com.
Awesome. Thank you, Dr. Gavrizi.
Thank you so much for having me.